Think about those moments. Maybe you catch your reflection and you kind of fixate on something you don't love. We all have those.
Oh, absolutely. It's pretty normal.
But imagine that focus just spirals.
Yeah.
Becomes this like overwhelming preoccupation, a constant source of distress that gets in the way of, well, everything.
Yeah.
Okay, let's really get into this because that feeling, that intensity, it might signal something much deeper than just being self-conscious.
Exactly. We're talking about body dysmorphic disorder, or BDD.
And the numbers are kind of surprising, actually. It's estimated to affect somewhere between 0.7% and maybe 2.4% of people.
Which is, more common than a lot of people think.
Way more common.
And what's really crucial to grasp here is that while almost everyone feels unhappy with their appearance sometimes, BDD is. It's a totally different ballgame. It's a serious mental health condition.
Right.
So in this deep dive, we're really going to unpack what body dysmorphic disorder is all about. We'll be looking at, research, diagnostic criteria from the DSM-5, clinical reviews, prevalence studies, the whole picture.
Exactly. Our aim today is to give you a really clear sense of BDD, what it involves, what might be behind it, and critically, how it's not the same as just worrying about how you look or vanity.
We want to provide a solid but, digestible understanding of this condition. It often flies under the radar.
Okay, so let's start right at the beginning. What is body dysmorphic disorder, fundamentally?
Okay, so at its core, BDD is this intense preoccupation, this fixation on a perceived flaw in your physical appearance.
Perceived flaw. So it might not even be noticeable to others.
Precisely. Or it could be a very minor physical thing that the person with BDD sees as huge, as catastrophic. You might also hear it called body dysmorphia, sometimes dysmorphic syndrome, or even the older term dysmorphophobia.
And it's just how powerful this focus becomes, right? It's not a passing thought.
No, not at all. The research shows these thoughts about the flaw become intrusive, they're pervasive, they can take up, several hours every day or even longer, just thinking about it.
Wow. Several hours.
Yeah, and here's the key thing. It causes severe emotional distress. We're talking significant anxiety, shame, depression. And it really disrupts daily life. Yeah. Work, school, relationships, just basic functioning.
That really puts it in perspective. It's not just a surface concern.
Not in the slightest. Now, if we look at how it's classified, the DSM-5 puts BDD in the obsessive-compulsive spectrum.
Okay, so related to OCD.
In some ways, yes. But it's distinct. For example, it's different from, say, anorexia nervosa, where the focus is primarily on weight and body size. BDD concerns can be about almost any body part.
And I think you mentioned something about delusional aspects.
Right. In about maybe a third of cases, the belief about the flaw can reach delusional intensity, meaning the person is completely convinced it's real and significant, even when it's entirely imagined.
Okay.
But even when there is a slight physical anomaly, the level of concern is way out of proportion. We often call it an overvalued idea, a really strongly held belief that isn't quite delusional, but is very resistant to evidence.
Got it. And the motivation here, it's not about wanting to look perfect, necessarily.
Generally, no. Research suggests it's less about striving for beauty or vanity and more about this deep-seated need to just feel normal, to fix the perceived flaws so they can blend in, so they don't stand out in a negative way.
That's a really important distinction.
Yeah.
So what sorts of body parts or features do people tend to focus on?
It can honestly be almost anything. The face is very common. Nose, skin, hair, chin, lips. Skin imperfections like acne or scarring are a big one.
Mm-hmm.
Also the stomach, arms, legs. But really, any body part can become the focus. And it's not unusual for someone to be preoccupied with multiple areas at the same time.
Okay.
And we should also mention muscle dysmorphia here. It's sometimes called bigorexia or reverse anorexia.
Right, I've heard of that.
It's a subtype of BDD, mainly seen in males, where they perceive their body as too small, too skinny, or not muscular enough, even when they're objectively quite muscular.
So the complete opposite of what you might typically expect with body image issues.
Exactly. It really highlights how distorted the perception can become.
Okay, so beyond this constant mental churn, these intrusive thoughts, what kinds of behaviors do we see? How does this manifest outwardly?
Yeah, this is crucial because the behaviors are often what cause so much disruption. There's a lot of repetitive checking, constantly looking in mirrors or reflective surfaces.
Or avoiding them entirely.
Or avoiding them, yes. Paradoxically, both can happen. Lots of it comparing their perceived flaw to how other people look.
Okay.
People might develop really specific, sometimes unusual routines to try and avoid social situations where they feel the flaw might be exposed or judged.
Just social avoidance is common.
Very common. Or trying to camouflage the area using excessive makeup, specific clothing, hats, scarves, controlling their posture. Anything to hide it.
It sounds exhausting.
It is.
Oh, yeah.
And the thing is, while these behaviors feel like they're helping manage the anxiety in the moment, they actually reinforce the preoccupation. They keep the focus locked on the flaw.
That makes total sense. It validates the fear, in a way. What else?
Uh, Repetitive changing of outfits is another one. Excessive grooming routines. Constantly seeking reassurance from others, asking, does this look okay? Can you see this flaw?
But the reassurance probably doesn't last long.
Rarely.
Right.
It might provide temporary relief, but the underlying doubt and anxiety usually creep back in very quickly. We also see skin picking sometime.
Picking at the perceived flaw.
Yes, which can ironically create actual lesions or marks where maybe there weren't any before, or make minor ones worse. And while it's distinct from eating disorders, some people with BDD might engage in restrictive eating if they believe it will help change the part of their appearance they're focused on.
It paints a really clear picture of how this internal struggle translates into these repetitive, often distressing actions. What's the overall impact on someone's life?
Oh, it's often profound. Quality of life can be severely impacted. We see significant problems in education, difficulty concentrating, dropping out of school, occupational dysfunction too, trouble holding down a job, poor performance.
And the social isolation you mentioned.
Exactly. It can be extreme. Some individuals become essentially housebound, sometimes for years, because the distress of being seen is just too overwhelming.
That's devastating.
It truly is. And tragically, the rates of suicidal ideation, thinking about suicide and suicide attempts, are very high in BDD. Research suggests they might actually be higher than in major depressive disorder.
Wow. That really underscores the seriousness.
Yeah.
You mentioned BDD is on the obsessive-compulsive spectrum. How does it connect with other mental health conditions? Are there common overlaps?
That's a really important point. Yes, there's high comorbidity, meaning it often occurs alongside other conditions. While it shares features with OCD, like the repetitive thoughts and behaviors, some studies suggest BDD involves even higher rates of depression and social avoidance compared to typical OCD.
Okay.
Social anxiety disorder is a very common co-occurring condition. The overlap is significant, and their development can be similar. Some researchers even suggest BDD could be seen as a specific type of social anxiety, one that's hyper-focused on appearance flaws.
So the fear of judgment gets channeled into the appearance concern.
Exactly. And sometimes this can escalate to the point where the person develops beliefs, sometimes near delusional or delusional beliefs, that others are actually secretly noticing, mocking, or talking about their perceived flaw.
That sounds incredibly stressful. What other conditions often appear alongside BDD?
Eating disorders are another key one. Studies suggest maybe up to 12% comorbidity. Both involve appearance concerns, obviously, but the focus tends to differ. Eating disorders more centered on weight and overall shape, while BDD can be about much more specific features.
Right.
And beyond that, you frequently see overlap with other anxiety disorders, major depressive disorder, and sometimes conditions on the psychotic or bipolar spectrums. It's often a complex mix.
It definitely sounds like a tangled web. So, turning to causes,
Yeah.
what do we actually know about why someone might develop BDD?
Well, like most mental health conditions, the current thinking points strongly towards a biopsychosocial model, meaning it's likely a complex interplay of different factors. Genetics probably play a role, a predisposition. Then there are developmental experiences, psychological factors, and definitely social and cultural influences.
Does it tend to start at a particular age?
It often begins during early adolescence, usually around 12 or 13, a time when, appearance concerns naturally become more prominent for many kids.
Okay. And what about life experiences? Trauma, bullying?
Yes, there seems to be a strong link there. Many individuals with BDD report histories of trauma, abuse, neglect, or significant teasing and bullying, often related to their appearance. There was a study in 2021, for instance, that found over 75% of adults with BDD reported experiencing childhood abuse. Emotional neglect specifically was highlighted as a significant risk factor.
How might that connect? Like the past abuse and the current body focus?
Well, one theory is that these negative early experiences can create a sort of fundamental sense of shame or defectiveness, maybe a feeling of being unsafe in one's own body. The intense focus on a perceived physical flaw might then become a way to unconsciously try and make sense of or exert control over those deeper feelings of distress.
Yeah, that makes a certain kind of psychological sense. What about our modern world? Social media, filters, selfies? Does that play a role?
It's a huge topic of discussion and research right now, and yes, the general consensus is that it likely does contribute, at least for some people, the constant exposure to idealized, often heavily edited images online.
Right, the perfect lives and looks we see.
Exactly. Sociocultural theories suggest we internalize these media and peer standards of attractiveness. Excessive social media use, especially focusing on appearance-related content, comparing oneself to others, striving for that ideal online presentation. It's thought to potentially fuel low self-esteem and body dissatisfaction.
It's like this constant comparison culture.
It really can be. For women especially, studies show that this comparison with often unrealistic media images can lead to a greater perceived gap between their own appearance and the ideal, which fuels dissatisfaction.
And the whole selfie culture.
So I think
Seeking likes and validation online.
that seems to be part of it too. The self-verification theory suggests we seek feedback confirming our existing self-views. If someone already feels insecure about their appearance, seeking validation through selfies might paradoxically reinforce those insecurities or even trigger BDD-like preoccupations if the focus becomes overwhelmingly negative.
That's so it can backfire.
It potentially can, yes. A big review in 2019 linked appearance-focused social media use quite strongly with greater body image dissatisfaction. It might even act as a mediator for what we call subthreshold BDD symptoms that aren't quite severe enough for full diagnosis but still cause distress.
And then there's that term Snapchat dysmorphia.
Right. That term popped up around 2018. It describes this trend of people wanting cosmetic surgery to look like their filtered selfies.
So look like the filter in real life.
Exactly. These filters create looks, poreless skin, huge eyes, altered face shapes that are literally impossible to achieve naturally or even surgically. The desire to replicate these unrealistic images is seen as another potential pathway or trigger related to BDD. It really highlights the distorting effect of these digital images.
It does, it's kind of alarming. Thinking bigger picture, historically or culturally, is BDD mainly a modern Western thing?
That's a great question.
Bro.
While our current obsession with appearance and cosmetic modification might feel very Western and modern, concern with body image isn't new, nor is it exclusively Western. Think about historical practices like Chinese foot binding. That was a culturally ingrained practice of radically altering appearance based on an aesthetic ideal.
Good point.
However, research does suggest that the prevalence of appearance modification and conditions like BDD seems to be higher and maybe increasing in Western societies. This could be tied to our specific cultural emphasis on certain aesthetic ideals, youth, and often linking appearance to success or mirth. Some studies have noted higher body dissatisfaction rates in Caucasian women compared to some other groups, for example.
So cultural context definitely matters. Do different cultures have different ideals that might influence this?
Absolutely. What's considered beautiful or desirable varies hugely. Factors like food security are a big one. In cultures where food is scarce, a larger body size might be seen as attractive, signifying health and status.
Yeah.
There was this fascinating study comparing women in Germany, Colombia, and Quechua women in rural Guatemala. The Quechua women, living more traditionally with less exposure to Western media and maybe fewer mirrors or scales, actually showed the biggest discrepancy between their actual size and how they perceived their size, often seeing themselves as thinner.
Interesting. But did that mean they were less satisfied?
No, interestingly, it didn't seem to negatively impact their body satisfaction, which is a finding also seen sometimes in studies with lower-income African-American women where there might be greater acceptance of diverse body types. It shows the link between perception and satisfaction isn't always straightforward.
So it's complex. And BDD isn't just Western.
Definitely not. Research shows significant rates of BDD in East Asian societies too, for instance, often with a particular focus on facial features, so it's a global issue, even if the specific concerns might vary culturally.
Okay, that gives us a much broader perspective. Let's shift now to diagnosis and treatment. It sounds like BDD might be missed sometimes.
You're absolutely right. Historically, it's been significantly underdiagnosed. It only formally entered the DSM, the Diagnostic Manual, in 1987, and clear criteria came later.
Why might it be missed?
Several reasons. People with BDD often feel intense shame or embarrassment about their concerns. They worry about being seen as vain or superficial, so they might hide their struggles, even from doctors. Also, not all healthcare professionals, even mental health specialists, are sufficiently trained to recognize it or ask the right questions.
So how is it diagnosed properly?
It really relies on careful questioning, asking specifically about appearance concerns, how much time they spend thinking about them, the level of distress they cause, and crucially, whether these concerns interfere with their life, social functioning, work, school. There are screening tools too, like the Body Dysmorphic Disorder Questionnaire, which are pretty good at identifying potential cases.
And getting that diagnosis early is important.
Extremely important because people can suffer in silence for years, sometimes decades. And given the high suicide risk we talked about, early intervention is critical.
Okay, so once someone is diagnosed, what helps? What are the effective treatments?
Thankfully, there are treatments that work. Medications can be helpful, particularly antidepressants like SSRIs, selective serotonin reuptake inhibitors. They can help manage the obsessive thoughts, the compulsions, and sometimes the delusional aspects.
That therapy.
Yes, cognitive behavioral therapy, CBT, is considered a first-line treatment. CBT for BDD focuses on helping people identify and challenge those negative, distorted thought patterns about their appearance.
How does that work practically?
Well, there are specific protocols, like the one developed by Dr. Sibylle Wilhelm and her colleagues. It typically involves several components. Psychoeducation, which is just learning about BDD.
Understanding the condition.
Exactly. Then cognitive restructuring, learning to catch and change those automatic negative thoughts. Exposure and response prevention, or ERP, is also key.
Exposure, like facing the fears.
Sort of. It involves gradually confronting situations that trigger anxiety about the perceived flaw, but without engaging in the usual compulsive behaviors like checking or camouflaging. This helps break the cycle, and often mindfulness and techniques to retrain perception are included too.
So it tackles both the thoughts and the behaviors.
Precisely. And even just providing good information, self-help books, reputable websites can be a valuable first step, even before formal therapy begins.
That's really encouraging.
Yeah.
What about cosmetic surgery? You mentioned Snapchat dysmorphia. Does surgery ever help people with BDD?
This is a really, really critical point. For the vast majority of people with BDD, cosmetic surgery is not helpful and can actually be harmful.
Why is that?
Because the core problem isn't the physical feature itself, it's the perception and the psychological distress attached to it. Changing the appearance doesn't fix the underlying BDD. The person often remains dissatisfied, or their preoccupation shifts to a different body part, or they find fault with the surgical result.
So it doesn't address the root cause.
Exactly. It can lead to multiple unnecessary procedures and worsen their distress. That's why collaboration between cosmetic surgeons and mental health professionals is so important to screen patients for BDD before any procedures are considered.
That makes complete sense. Focus on the psychological treatment first. Lastly, just briefly, you mentioned the term dysmorphophobia from way back. Can you give us a quick historical snapshot?
Sure. The first real description seems to come from an Italian psychiatrist, Enrico Morselli, back in 1886. He coined dysmorphophobia, literally fear of an abnormal shape.
1886. Wow.
Yeah, but it took a long time to be formally recognized. The American Psychiatric Association included it in the DSM in 1980, but initially as an atypical somatoform disorder. The name was changed to body dysmorphic disorder in 1987. Then DSM-IV in 1994 refined the criteria, emphasizing the distress and impairment. And most recently, DSM-5 in 2013 moved it to the obsessive-compulsive chapter, added specifiers like the muscle dysmorphia subtype, and clarified criteria further. Even Freud actually wrote about a patient, the famous Wolfman, who showed clear BDD symptoms. So the phenomenon has been observed for a long time, even if our understanding and classification have evolved.
It's fascinating how our lens for understanding these things sharpens over time. Okay, so as we wrap up this deep dive, what's the single most important thing you hope listeners take away?
I think the absolute key takeaway is that BDD is a serious, distressing, and impairing mental health condition. It's far beyond everyday appearance concerns or vanity, and it deserves appropriate recognition and treatment.
Absolutely. And building on that, here's something for you, the listener, to maybe chew on. As digitally altered images become even more pervasive, and online validation plays such a big role in self-worth, how might this shape BDD or BDD-like tendencies in the future? What does this mean for how we see ourselves collectively?
It's a really vital question for our times. And importantly, if anything we've discussed today resonates with you or makes you think of someone you know, please do seek out more information from reputable mental health resources. Talk to a professional. Help is available, and treatment really can make a difference.
Thank you so much for joining us for this deep dive into body dysmorphic disorder. We really hope this has offered some valuable clarity on a complex and often hidden condition.